I'm Dr. John Chessare, the President and CEO of GBMC HealthCare. This has been wonderful for narrowing the gap between the front office and the front line. I know so many more of our nurses, physicians, techs, housekeepers than I did before, and there's a closeness now, and there's an understanding that the expectation is they believe not only is it their right to suggest changes to the system, it's their duty to suggest changes to the system, but not randomly, to suggest changes to the system to get us closer to our vision and to treat everyone every time the way we want our own loved ones treated. That is a vision of perfection. We'll never quite get there, but shame on us if we're not learning from every defect to try to get there, because every time we don't meet our vision, somebody is suffering. A big problem for healthcare is that people have been measuring services rendered, and chief executives have been rewarded for the number of services they sell. And yes, people always gave lip service to clinical outcomes, patient safety, but they were really judged on what was the net operating income. And it's kind of a sad indictment on healthcare leadership, because you could get a high net operating income by selling things at high prices that were not actually beneficial to the patient. It sounded good. The patient has no way of knowing whether or not this MRI is actually going to lead to some change in therapy that will actually help them. So healthcare has really lost its way. And now to go back and to focus on the triple aim, and at GBMC the quadruple aim, really gets us back on track. It's very sad that most healthcare organizations are not-for-profits, and their mission statements are all designed to help the community, but sometimes they deviate and it looks more like their mission statement is financial return on investment, irrespective of value. So in Maryland, we're delighted that we have a waiver with the Centers for Medicare and Medicaid Services that are changing the incentives to actually create a more value-driven healthcare system. We need to get that 40% back for the American people. We need to give it to employers so they can make their businesses stronger and hire more people. We need to give it back to government so they can spend it on paving roads and making the schools better. And we need to give it back to individuals so that they can use it for other needs for their family.